Welcome back, guys. Today we are going to see the procedure of positioning, putting a patient in a semi-recumbent position. So these are the step-by-step guide, one which you are supposed to follow when you are doing this procedure. So step number 1, you need to organize the 3 pillows. You need 3 pillows, and then greet the patient and explain the procedure to him or her. Say, we want to change you from this position to this position. This one will help you to prevent pressure sores, to relieve pain. Those one also can make you comfortable. So you explain those things to the patients. This one in examination room, you need to. And then you need to provide privacy. You need to use the screen. Now, any procedure which you do, privacy is paramount. And then you need to go and wash your hand before coming and doing the procedure. Then prop up the patient with the 3 pillows. Then make the patient comfortable and thank him or her. Then clear away and wash the hand, document the procedure, and then mention the indication for recumbent position. So, in recap, you need to organize the 3 pillows. This is 1 mark. Greet the patients and explain the procedure to the patient. That is 2 mark. You provide privacy. That is 1 mark. Prop up the patient with the 3 pillows, that is 3 marks. And then make the patient comfortable and thank the patient, that is 2 marks. Then clear away and wash your hand, that is 2 marks. Document the procedure, anything you do you need to document, that is 2 marks. And then mention the indication for the position, that is 2 marks. Total 15 marks. Thank you for watching. See you in the next one. Consider subscribing if you want more video like this.